Well, it's at the top of the hour, so we're going to go ahead and get started with our Alliance 101 presentation today. Thank you so much for those of you who are joining us. These are webinars that presentations that we offer twice a year for anyone who wants to learn a little bit more about the Alliance. And so we're glad to have you join us today, especially in this busy time of year as we're all getting ready for the holidays. I'd first like to introduce the Alliance team. We'll each introduce ourselves so you can get to know us, and then we will share with you some information about the Alliance. So my name is Leanne Swanson. I'm the Executive Director of the Alliance. I've been at the Alliance about 6.5 years, and I got involved in organ donation and transplantation actually in a prior role before coming to the Alliance. I worked for the Arizona Hospital and Healthcare Association, and in my role there, I was the liaison between our member hospitals and the OPO in Arizona, which is Donor Network of Arizona. And some of the history that I'm going to be talking about shortly about the National Breakthrough Collaboratives, I participated in those as a member, as a team member really, of the OPO. And so I've been not only with the Alliance for 6.5 years, but really involved in donation and transplantation for about 15 years, if you include my time at the Hospital and Healthcare Association. So I'm pleased to join you, and thanks again for being here, and I will turn it over to Corey.
All right, thanks, Leanne, and hi, everyone. My name's Corey Bryant. I'm the Director of Communications here at the Alliance. Next year it will be 3 years that I've been with the Alliance, and I'm presently located in Tuscaloosa, Alabama. Prior to that, I spent about 10 years in Orlando, Florida, and for many of those, I worked for the OPO serving Central Florida. So that's kind of my connection to donation and transplantation. So it's my pleasure to introduce our program manager, Deanna Fenton.
Thank you, Corey. Hello, everyone. As Corey mentioned, my name is Deanna Fenton. I'm the program manager here with the Alliance. And I've had the pleasure of being a part of the team for just under 2 years now. But previously, I worked for the OPO based here in New Jersey, where I served in the clinical department in hospital development. I'm thrilled to be here with all of you today, and I look forward to sharing a wealth of knowledge about the many resources we have to offer. So with that, I'll go ahead and turn it over to my colleague, Felicia.
Hi, my name is Felicia Elizondo. I am the program assistant here at the Alliance. I've been with the Alliance now for a little over a year. Prior to that, I worked at a transplant center for about 20 years as a financial coordinator and business office supervisor. I'm very pleased to be here with you guys today, and I'll go ahead and hand it over to Glenn.
Hello, my name is Glenn Matsuki. I'm the program consultant for the Alliance. I've been with the Alliance for almost 2 years now. My career in donation and transplantation started back in the year 2000 when I joined the transplant program at Cedars-Sinai Medical Center as the assistant to the director of liver transplant and the transplant administrative coordinator. After that, I joined an OPO, One Legacy in Los Angeles, where I was the donation development coordinator and was assigned to various trauma centers around Los Angeles. As you can imagine, it was a very challenging job. I'm very, very pleased to be with the Alliance. We have a very talented group of individuals, but more importantly, I get to work with all of the professionals throughout the nation who are working very diligently in increasing the number of organs for donation, as well as improving transplant outcomes. So with that, I'll turn it back to Leanne.
Thank you, Glenn. And Valinda Jones couldn't be with us today, but Valinda is also a program consultant. She is a transplant nurse and has retired from that role. However, she does serve on the UNOS Board of Directors, and she's currently at the UNOS Board meeting. So she apologizes for not being able to be on today's 101 presentation. And I do want to point out that we all work from our home offices. So the Alliance is 100% virtual organization. So we don't have a home-based bricks and mortar office location. So we cover the country in terms of where we are all located. So again, the presentation today, we're going to focus on a little bit of the history of how the Alliance came to be, and then our present status, and then we'll share with you some of our future and new offerings that are in development. So a little bit about the history. We know that there are, at any given time, the number fluctuates, but about 118,000 people waiting for a transplant. And back in 2003, when there were actually only 80,000 people waiting, it was the wait list for organs was actually declared a national crisis. And so as a result, Tommy Thompson, who was the Health and Human Services Secretary at the time, joined with key stakeholders to launch what was called a National Breakthrough Collaborative. And the goal of that collaborative was really, there were several goals, but primarily it was to increase the number of transplantable organs and to increase the organ donation rates by 75%. And how that collaborative came to be, the focus really changed the culture of the donation and transplantation community. You can forward to the next slide, Corey. And what the purpose of that collaborative was for the 3 estates, the OPOs, donor hospitals, and transplant centers, to start collaborating and working together to share best practices, to share bold offers and requests, in an effort to really better serve the donor families and transplant recipients. And here's a little bit of the timeline. So it started in 2003, and I'll just explain the acronyms here. The first one was the Organ Donation Breakthrough Collaborative. And the collaboratives, I should mention, consisted of 3 fast-paced learning sessions each year, and then a large national learning congress where OPOs, hospitals, and transplant centers would come together, learn from each other, share best practices with the goal of going back and replicating those efforts. And so the first one was the Organ Donation Breakthrough Collaborative. A couple years later was the Organ Transplant Collaborative. Then there was the Organ Donation and Transplantation Breakthrough Collaborative. And then finally, the Transplant Growth and Management Collaborative. And out of these collaboratives came different change packets, different concepts, different best practices, resources that were developed, again, in an effort to share across those 3 estates to improve the processes and practices. When those collaboratives came to an end, there were several OPO leaders that got together and realized that there wasn't an organization out there that really represented all 3 estates and that could continue this collaboration effort. And so with the funding support of about 35 OPOs, the Alliance was created as a nonprofit organization in 2006. And we, for several years in the later 2000s, we received a 3-year cooperative agreement from HRSA to continue a lot of the efforts and resources that were developed as part of the collaborative. And when that funding came to an end, we decided to really transform the Alliance, sticking with our core principles upon which we were founded of providing professional education across those 3 estates. But we realized that we needed to strengthen our mission and focus within the donation and transplant community. And so we are not a membership-based organization. We receive our funding support from voluntary financial support from OPOs and transplant centers from across the country. So in 2015, we also revised our mission statement, enhancing it to focus on the 3 core pillars or principles upon which we were founded, which are engaged learning, innovation, and of course the collaborative leadership. And then our vision is here as well. And part of our strength, I think, as the Alliance comes from our diverse board of directors and who's represented on our board and who supports us in our efforts. So we have an 18-member board comprised of OPO and transplant leaders from across the country. But in addition, we have 8 community partner or national partner organizations, several of which are hospital and healthcare focused, such as the American Hospital Association, the American College of Healthcare Executives, the Joint Commission, the Society of Critical Care Medicine. So it's not just donation and transplantation focused organizations that serve on our board. And again, that helps us to make sure that we are reaching the broader community of those 3 estates. So as I mentioned, we rely on voluntary financial support from our professional partners. And those partners, again, are comprised of OPOs and transplant centers. And we're going to show you a series of slides here of who those partners include. And I'm pleased to say that we actually, for just this past year, have had 6 new transplant centers join at the highest executive level partnership of the Alliance. But we have many, many hospital OPOs and transplant centers who join at our different levels, which include our executive level, partner level, colleague level, and discovery level. And for their partnership, it's an organizational partnership. They receive different professional education benefits, complementary programs, or discounted benefits to our resources. And we also rely on our corporate partners, our annual corporate partners, and we have different levels, and you can see them listed here. And these are corporate partners who also are instrumental in helping the donation and transplant community. So we are very grateful for their support as well. So I'm going to talk just briefly about our 3 leadership councils, and then I'm going to turn it over to our team to talk about, oh, good. My phone is ringing. Sorry about that. Corey, can you take over this?
Sure, absolutely. So we are proud to host 3 national leadership councils that kind of comprise a lot of who we are and what we do. And these are organizational representatives from across the donation and transplantation continuum, and also the healthcare continuum as well. And so many of these representatives sit on one or possibly multiple of our leadership councils, usually only one at a time. But our Donation Leadership Council is a council that's represented by members across the donation and healthcare fields. And many of them gather to kind of put together some of our various programs and initiatives that you see throughout our communications. So one is our ODASSCE program, a newer resource that they just put out, the Community Hospital Resource Guide, which we'll talk a little bit more about later. The National Donor Management Summit, which is one of our biennial signature events that we just hosted this year and will host again in 2021. One of our initial resources, which was the Saving and Healing Lives video. And then, of course, the Organ Donation Toolbox, which I'm sure many of you are probably familiar with, which is just a big anthology of resources that are available to the organ donation community of practice. The Transplant Leadership Council is comprised of mostly leaders in the transplant continuum and the healthcare continuum. And they focus on more transplant-related initiatives, such as the OPO Transplant Communication Project, things like our Transplant C-Suite Snapshot series, the Transplant Resource Guide and Tools, our OnboardingU training program for transplant professionals, and our Transplant Mentorship program. So you'll get a chance to hear about more of those as we move forward with today's program as well. And then, of course, we have our Leadership and Innovation Council, which produces a lot of our specialty content, such as our innovation webinars. And they are also the team behind our National Critical Issues Forum, which is our second biennial event that gets hosted on the even years. So the National Critical Issues Forum will be hosted next year in 2020. So to talk a little bit further about some of our professional partners and the Alliance Ambassador Program, I'm going to hand it over to Felicia.
Thank you, Corey. Each professional partner organization has an appointed Alliance ambassador. This person serves as a local liaison for all things Alliance and serves as a point of contact for the organization's complimentary webinar connections, on-demand webinars, and other learning opportunities. They also serve as the person who helps us ensure that everyone at their organization has the opportunity to receive our communications and has access to the Alliance community portal. Alliance ambassadors participate in several calls per year to stay up to date on our new programs and initiatives. If your organization is already a professional partner, but you're not sure who your Alliance ambassador is, we've now made it easier for you to find out. You can visit our partnership section of our website. Under the About Us tab, you'll find a link to the list of Alliance ambassadors by organization. I will now hand it over to Deanna to speak on our education opportunities.
Thank you, Felicia. So for the next few minutes, I'd like to introduce you all to some of our education and training resources, which will of course include our webinar offerings. So annually, the Alliance hosts 25 webinars, which aim to provide education and information on the latest cutting edge discussions and topics. Additionally, these webinars seek to address the needs of the donation and transplantation community. So over the course of the next year, you can expect to see 10 donation-focused webinars, 10 transplant-focused webinars, and 5 of our special webinars, which will include our 2 annual brain death webinars. One of which will be geared towards our physician colleagues, and the other will be geared towards our nursing colleagues. Lastly, we'll host our 3 innovation webinars, which will highlight new technologies, techniques, and ideas in the community. You can register to participate in either the live presentation of our webinars, purchase the on-demand recording, or do a combination of the 2. Now, while the registration links for the live webinar presentations cannot be shared, the Alliance does encourage you to arrange a group webinar viewing for your organization. Everyone listening in that group would be entitled to receive the continuing education credits that are offered for each of our webinars. At the conclusion of the webinar itself, the individual who actually registered for the webinar will receive the evaluation link that we ask them to share with your group. All Alliance webinars, whether live or on demand, do carry a certificate of participation. They also come with CEP-C credits, nursing credits, and CME credits when applicable. One thing to note is that our Alliance professional partners are eligible to receive discounted rates for our webinar registrations. So if you're unsure of your organization's partnership level, please feel free to visit our website. Again, under the partnership section that Felicia referenced, you can find that information there. And you can also feel free to check with your organization's Alliance ambassador to get more information on all the benefits that we have to offer. We encourage you to visit our website. Again, that's at OregonDonationAlliance.org. And there you can check out our live webinar offerings, which will be housed under the Education and Meetings tab. Here you can also keep up to date with the webinar schedule, find downloadable flyers that can be shared with your organization, and register for any of our upcoming webinars. You can also find out about our upcoming webinars through our email announcements and social media channels. Now, for more information specifically about our on-demand offerings or to register for one, you can visit our Alliance Academy webpage, which can also be found under that Education and Meetings tab. For 12 months from the date of the live webinar, the on-demand recording can be viewed. The same continuing education credits that are offered for the live webinar are also available for that on-demand recording. For either webinar, whether it's the live or the on-demand, you will be asked to complete a very brief evaluation, which will allow you to provide us with your feedback. And then following the submission of that evaluation, you will receive your certificate. After 12 months from the date of the live presentation, most of our webinars do become free and available upon request. So if you're interested in viewing some of these webinars, please visit our archive section of the website. But one thing to note for those archived webinars is that they no longer carry any continuing education credits. Let's see, so another educational, oh, sorry, Corey, if you can go back to the previous slide. Another educational offering that is provided by us is our monthly education corners. These are our one-page educational resources that are on hot, relevant topics, or in some cases, they'll be on topics that were presented on a previous webinar. These one-pagers are geared towards our hospital staff who are involved in the donation process, as well as professionals within the donation and transplantation community. To find these one-page resources, again, you'll navigate to the Education and Meetings tab on our website, where you'll be able to download either of the summaries that are available. We ask that you share them with your hospital staff by posting them on bulletin boards or emailing them out as attachments. We are also proud to be a provider of a diverse collection of resources for the donation and transplantation professional community. Everything that we offer is conveniently housed on our website. As a reminder, that's going to be at organdonationalliance.org. There you'll find all of our initiatives and offerings categorized by education, community, and resources. You'll also be able to find out more about the Alliance as an organization and the exciting impact that we get to bring to you all every single day. One of the many resources you'll find is our C-Suite Snapshot series, which are one-page informational publications on topics that are relevant to senior executives of hospitals and transplant centers. The Hospital C-Suite is a reoccurring one-page issue which focuses namely on organ, eye, and tissue donation-related topics. Each issue is typically accompanied by references, resources, and tools, as well as a brief video that's presented to you from a hospital CEO's perspective on the topic at hand. The Alliance distributes these resources biannually for dissemination to your senior leadership and hospital colleagues. Our Transplant C-Suite Snapshot focuses on topics specifically relevant to senior leaders of transplant centers and transplant hospitals. Our most recent publication focused on establishing a successful transplant model, while previous issues focused on regulatory oversight, Medicare reimbursement for organ acquisition costs, as well as provider profitability and reimbursement. These one-page summaries are also accompanied by brief webisodes, which will be presented by an industry expert on the respective topic. Now here to share some more with you about our robust library of resources is my colleague, Corey. So Corey, I'll go ahead and turn it over to you.
All right, thanks, Deanna. So if you'll recall, we mentioned the Saving and Healing Lives video just a few minutes ago. And one of the first things that the Alliance produced as a free educational resource to the community was the Saving and Healing Lives video. So this is a 30-minute video, which was created by our Donor Management Leadership Council at the time. It's now the Donation Leadership Council. It provides an overview of the donation process for healthcare professionals. And this video offers both CME and CEPC credits. So you can access the Saving and Healing Lives video through our website by selecting the training video under the Education and Meetings menu. Now, OnboardingU is something you probably heard a lot about from us, but it's our online training program for transplant staff. So this initiative draws from the expert knowledge of transplant colleagues from across the country. We have a really diverse work group, and they create a library of online training modules which are intended to supplement a transplant center's new orientation program. So we've designed this resource to provide all newly hired transplant staff with a really solid foundation of field-related information, which will, what we hope, facilitate success in their new role and also promote employee engagement and retention as well. So the program launched with 4 foundational modules, which lay the groundwork for any new transplant professional. And those are things like Introduction to Transplantation, History of Transplantation. There's a module called Regulations, Compliance, and U, and then Data Accuracy and Timeliness. Now, we've since added a foundational module called Patient Education 101 as well. So as we move forward, we're adding new modules on a regular basis, including a series of 8 role-specific 101 style modules with more on the way. So these range from transplant social work to transplant finance, transplant coordinator, transplant social work, and a brand new 2-part series on transplant administration. So new modules, including a transplant dietitian module and also an inpatient nursing module, are also in continual development with our OnboardingU work group. So users who take part in OnboardingU have the opportunity to earn CEP-C or nursing credit for completed modules, and we know of some organizations who have also discussed using elements of this program for annual competency training and renewals. So this program can also be used to help satisfy regulatory training requirements related, of course, to training and orientation, and is also a Medicare reimbursable training expense. The program is available through a one-year subscription, which offers access to the full training library, and pricing is based per user and is available on our website. So there are also some special pricing discounts available for Alliance professional partner organizations, and even bulk discounts for programs interested in registering a significant portion of their headcount. So to learn more about that, you can visit OnboardingU under the Education tab of our website. Now, we also launched the Alliance Transplant Mentorship program back in fall of 2017, which provides another resource to newly hired transplant professionals or even those who are new to their specific role. And the mentorship program provides new transplant professionals with access to an experienced mentor connection across the country and engages experienced professionals to support them while they immerse themselves into what we know is a very complex field. Now, the goal of this program is to establish a network of support for transplant professionals in order to inspire and encourage them, and we hope pave the way to career success and longevity for them. So we're very proud to report that by the end of our last enrollment period, we have established more than 125 transplant mentor-mentee relationships across the country. Now, there are three types of mentorship programs that we offer. And those are one-on-one mentorship in which they can be assigned to a mentor or mentee for an ongoing relationship of 6 to 12 months or beyond for guidance and growth within the mentee's role. There is a group mentorship offering, which they can gain access to a discussion board for mentors and mentees and post their questions to a vast group of professionals. Or there's also a third program, which is situational or skill-specific mentorship, in which they can be assigned to a mentor or mentee for a limited time to participate in knowledge sharing for a specific situation or skill. Now, we open these application periods on a biannual basis. The next one, which will be in January, Deanna, is that correct? I believe it is January. So you can learn more by visiting the mentorship program on the resources tab of our website. Now, to give you some future insight, we are planning an OPO version of the mentorship program. There has been a lot of interest in that, and that is something that we plan to launch early next year. So stay tuned for more announcements, which will be a very similar construct to the transplant mentorship program. And with that, I'll hand it over to Glenn to talk about our new virtual town hall series.
Thank you very much, Corey. Yes, it's been a very exciting year because this year we launched the virtual town hall series, which is a free collaborative opportunity that highlights successful OPO and transplant program relationships from across the country. And these pairing of OPO and transplant program also present the results from their collaborative efforts. This program is free, as I mentioned, and we do invite programs to share their experience and collaboration, and also offering solutions to critical challenges or innovative practices that may be emulated for success. We are currently planning our 2020 virtual town hall series, so please stay tuned for regular announcements on our live virtual meetings. The virtual town hall is also recorded, so if you miss this any of the series, you may be able to log back on and listen to the recordings as well. One of the most important, I personally feel that one of the most important endeavor that the Alliance took on this year was to create the Community Hospital Resource Guide. And it is specifically developed for community hospitals to enhance their knowledge as well as their donation performance. As you know, in the smaller hospitals, donation is an infrequent occurrence, but is highly impactful. Impactful for the hospital staff, as well as the community, surrounding community that they serve. So the guide is directed to the CEO and senior leadership, in which the leaders are asked specific questions to lead them down the path of evaluating their donation program. The guide serves several purposes. The first is to increase awareness of hospital data that measures donation performance and offers a peer-to-peer comparison to similar facilities. The guide is also established to provide education on donor management processes and practices. It provides best practices for collaborating with the OPO, as well as interdepartmental partnership towards the development of an interdisciplinary donation console. We also have built into the Community Hospital Resource Guide a vital resource for donation education in terms of executive education, staff education, and public education, all the while encouraging a very close relationship with their local OPO. You can find the resource guide on our website. When you do go into the website, you will also find a one-page downloadable document that if you are having a meeting with a CEO or senior leadership, you may take in with you to the meeting and will serve as a great primer for your discussion and for evaluating the organ donation program. So I encourage you to investigate this document and please make use of all that it has to offer. One of the first endeavors of the Alliance is the Organ Donation Toolbox. It houses close to 600 peer-shared resources, such as policies, protocol examples, practice checklists, educational tools and ideas, algorithms, flowchart, and all of these are from your peers across the country, and as we solicit annually new tools and resources for the Organ Toolbox. There are a lot of references and links to relevant articles, and we always do welcome new additions. So if you have tools or practices that you would wish to share, please let us know and click on the link at the bottom of the tools site. The other guide that we've created is remarkably similar to the Organ Donation Toolbox. While the toolbox serves the donation side of the practices, this resource serves the transplant community. The resource guide provides a roadmap to best practices for developing sustaining high quality, patient-centered excellence in donation and transplantations. Included are strategies, change concepts, and actions intended to enhance the infrastructure and operation of all transplant programs. And in support of the guide, also housed on our website, is a robust selection of resources, templates, and worksheets. Now you should note that both the Organ Donation Toolbox and the Transplant Resource Guide and Tools also offers a mobile application which you can download. So if you go to either the toolbox, the Transplant Resource Tool Guide, or the Organ Toolbox, there is information on how to create that shortcut on your mobile device. So with that, I'd like to turn over to my colleague, Corey, for additional information.
All right, thanks for that, Glenn. And the Alliance Job Board is another new initiative that was launched in late 2018. So this is a new section of our website that offers employers to post positions from across the donation, transplant, and healthcare community. And one of the big perks of it is that our professional partner organizations also receive a significant number of free postings per year. So the details for that are available on our website. So if you go to our website and click on the community tab, you will find our job board there as well. So with so many resources, I know that we've talked to you through many of them, and all of the learning opportunities that we have to offer to you. How do you stay up to date so that you know that you're not missing anything? Well, we aim to make that as simple as possible for you. So we have created what we call a weekly digest called the Monday Minute, and it details our newest initiatives and our learning opportunities throughout the year. And you'll also receive a regular webinar digest email that details all of our upcoming webinars so that you never miss a chance to attend a learning opportunity and earn CE credit. We also have our Alliance blog on our website, which is called What's Trending. It's updated regularly for trending news, education, and innovation-based articles within our field. We actually just posted about the first DCD heart transplant, which took place at Duke last week. We also publish these blog articles on our social media channels as well, so you never miss one. Now, each year we also publish our annual impact report, which has been distributed as of September and early October of this year. And this report highlights the Alliance's impact and progress we've made together over the course of the past 12 months, including vast accomplishments in education and innovation. And a digital publication is also available on our website. Actually, if you log on to our website, the very first image that you will see is a link that will take you to our 2019 impact report. Now, the impact report also houses our 2020 partnership assessment as well, and highlights all of the benefits of professional partnerships and all of the benefits and entitlements that you will receive as a professional partner. Now, we also host a national listserv with more than 2,000 participants, and it provides a forum for subscribers to post questions and share best practices among the community of practice. And you can also sign up for that by visiting our website. Now, as I mentioned a little bit earlier, we have two signature in-person events, which are hosted on a rotating basis. The National Critical Issues Forum, which will be hosted next year, with our date and location to be announced soon. This is a one-of-a-kind event that's geared toward collective brainstorming among the professional community. Each forum takes on critical topics that affect the donation and transplant community, and it leverages the Alliance's unique collaborative platform to create innovative solutions and develop the necessary tools to affect change. So some of those tools are available on our website, such as the 2018 Great Ideas Strategy Guide, which was developed after our previous forum and includes the top problems and proposed solutions from the 2018 forum. There's a lot of really great ideation in that guide, so I encourage you to check it out. And then also, which recently was published, a position paper from our 2016 forum is also available. And that focuses on understanding how to improve information and behavior for better decision-making in identifying potential donors and utilization of organs. So above all, stay tuned for our 2020 National Critical Issues Forum. That's a really great opportunity for you to participate in. And then our 2021 National Donor Management Summit, the date and location will be announced next year, but that's our other in-person event, which is hosted on the odd years. So our next event will be hosted in 2021. And this summit brings together nationally and locally recognized experts in the field of donation and transplant, and they share and discuss how to effectively integrate organ donor management practices throughout the continuum of care. So as I said, we'll be announcing information about the 2021 summit later next year. All right, and we also have a specialty in-person training program, which is produced on an on-demand basis. Now, this is a full-day interactive course called ODASSCE. It stands for Organ Donation Advanced Seminar for Standardized Clinical Education, which is a mouthful, and we all love our acronyms here in healthcare. But as I said, it's a full-day interactive course. It's developed and presented by field experts, and it broadly examines the comprehensive donation and transplant process, and it's designed for the multidisciplinary healthcare team. So the ideal attendee for ODASSCE includes early career critical care providers, residents, fellows, nurses, physicians, RTs, advanced clinicians, and even early career OPO professionals. So ODASSCE utilizes interactive lecture and case scenarios and video to teach the history of donation and transplant, an overview of the national system, clinical and legal considerations, administrative processes, and various roles and responsibilities within the process. So each attendee will also receive an exclusive course textbook with more than 14 chapters written by some of the country's foremost authorities in donation and transplant. It's a really fantastic resource that the Alliance has spent many years honing. So to learn about bringing this course to your facility, you can visit the ODASSCE section of our website or contact us to arrange a course at your facility. We'd be more than happy to discuss that with you. Now, we've mentioned our social media platforms several times today, and we would absolutely love for you to connect with us using any of the major social media platforms that you subscribe to. So you can connect with us on Facebook, Twitter, or LinkedIn, and as well as our YouTube channel, where we post some of our own video content, but also have playlists that take on a number of field-related topics as well. So with all that in mind, I will hand it back over to Leanne.
Thank you, Corey. So hopefully you have a better idea now of some of the resources that the Alliance offers or has on our website, some of the new programs in development, and a little bit about our history. So all of the great work that the team shared with you today, of course, is accomplished by the great, amazing team that I get to work with every day. But we also couldn't do it without the more than 100 plus volunteers from the donation and transplant community who serve on our work groups, on our councils, who share their time and expertise to help us develop these resources and educational offerings. And so I would encourage you to get involved. We call our volunteers the Alliance A team. And actually this graphic that you see here is the amazing work that Corey did for our annual impact report last year. And these are pictures of many of our volunteers, board members, etc., captured in this image. And again, Corey mentioned several ways to get involved. You can sign up for our listserv and participate in the discussions amongst your peers. You can join us on our social media channels. We just did a call for our national leadership councils. We often do a call for volunteers for our various work groups, and all of that you can find in our Monday Minute that Corey sends out. So if you are interested in ever participating and wanting to get involved in some of the programs we are developing, we are more than happy to have you join us. The other way we want you to get involved is by sharing your story. We know that several of us who work in donation and transplantation are impacted ourselves by what we do. Maybe you are a donor mom or brother or sister, or you're perhaps a transplant recipient yourself. And so on our website, we actually share the stories of our professional colleagues, and it helps us it reminds us every day of the important work that we do and connects us to our purpose here in the donation and transplant community. So if you do have a personal story you want to share, please, you can go to our website and just fill it out on our website, and we'd be happy to post and share your story with the community. So with that, I want to leave some time if any of you have any questions. I believe everyone's phone is muted, but I think you can personally unmute your phone, or if you look at the toolbar on the bottom, you can type a question if you have any questions to ask of me or the rest of the Alliance team.
Yes, I believe if most of the lines are muted, so if you're unable to mute yourself, you're more than welcome to enter a question in the chat box. So if you look at the lower toolbar, the chat feature is down there. Enter a question, and as Leanne said, we'll be more than happy to field those for you.
And as we give it a minute or two, if anyone has questions, you can also find our contact information on our website, our email addresses, or you can always just email our general Alliance email address, which is info@odt-alliance.org. All right. Well, I'm not seeing any questions or hearing any questions. But again, we appreciate you sharing your time and learning a little bit more about the Alliance, and hopefully you will become involved in our efforts. And if you already are involved, thank you so much for your participation. Again, we do host these, we'll host them again in 2020. So if any of your colleagues might benefit from learning about the Alliance, I think we also might make this available on our YouTube channel. I'm not sure about that, but you can always check there if you want to go back and revisit this presentation. But with that, I want to wish everyone a very happy holiday season, a healthy 2020, and we look forward to our continued participation and efforts next year. And thank you so much for all that you do.
Thanks, everyone.
Thank you so much.
Thank you.